Did you know that a virus you might not even realize you have could be putting your health at risk? HPV, or human papillomavirus, is incredibly common and often silent, yet it can lead to serious health issues if left unchecked. Today on Ask Fabio, we're answering the most important questions you need to know about HPV. What is HPV? HPV stands for human papillomavirus. It's a very common virus with over 200 types, some of which are harmless, while others are high risk and linked to conditions like genital warts and even cancers. It's considered the most common sexually transmitted infection, affecting millions of people worldwide. How is HPV transmitted? HPV is transmitted primarily through sexual contact, including vaginal, anal, and oral sex. But here's something many people don't realize. It can also spread through skin-to-skin contact, even in areas not covered by a condom. This means that intimate contact, even without penetration, can lead to infection. Can I get HPV without showing any symptoms? Yes, and that's one of the tricky parts about HPV. Most infections in men are completely asymptomatic. You might carry the virus without knowing it, which means you can still pass it on to others, even if you feel perfectly healthy. If I don't have warts or lesions, can I still infect someone? Absolutely. HPV can exist in a latent state, meaning the virus is present in your body but not causing visible symptoms. This is why safe sex practices and regular checkups are essential, even when you feel fine. What are the health risks of HPV for men? For most men, HPV infections clear up within a year or two without causing harm. However, persistent infections with high-risk types can lead to more serious conditions, such as penile cancer, anal cancer, and throat cancers. These risks are higher in men who have sex with men and those with weakened immune systems. Can HPV be prevented? While there's no way to completely eliminate the risk of HPV, there are effective ways to reduce it. The HPV vaccine is one of the best tools available. It's recommended for boys and men up to age 26 and protects against the types of HPV most commonly linked to cancer and genital warts. Using condoms consistently and limiting the number of sexual partners can also lower your risk. Is there a way to test for HPV in men? Currently, there's no routine HPV screening test for men like there is for women. However, molecular studies such as PCR can detect the virus in some cases, especially in high-risk individuals. Regular self-examinations and consultations with a healthcare provider are key for early detection of any unusual changes. Can I get rid of HPV once I have it? There's no direct cure for HPV, but most infections are cleared naturally by your immune system. For those that don't clear, treatment focuses on managing symptoms like warts or addressing any related health complications. If my partner has HPV, should I be concerned? If your partner has tested positive for HPV, it's possible that you've been exposed, but it doesn't mean you'll develop symptoms or health issues. Open communication, regular health checkups, and getting vaccinated if you're eligible are important steps you can take together. What's the most important takeaway about HPV? HPV is common and often harmless, but it can have serious consequences if left unchecked. Vaccination, safe sex practices, and staying informed are the best ways to protect yourself and your partners. Remember, knowledge is power when it comes to your health. So in conclusion, HPV doesn't have to be a mystery. Protect yourself, protect your partners, and talk to a healthcare provider about any questions or concerns you might have. If you found this video helpful, hit that like button, share it with someone who needs to know, and don't forget to subscribe to Ask Fabio for more clear, reliable health information. Stay safe, stay informed, and I'll see you next time.